This video is going to demonstrate the Apley scratch test, and so it's going to test range of motion of the shoulders, and you're going to compare one side to the other. So the first thing I'll have you do is go ahead and reach your hand up and over. And so this is testing abduction and external rotation. And so I'm going to see how far it goes down on her spine. Then I'm going to tell her you can put this arm down and do the same thing with the other hand. And you're going to compare them so they go to about the same level. And so that's one part of it, and then you can relax. And then the next part is I'm going to have you bring it back behind you. And this is testing a deduction and internal rotation, and so you would compare the sides with that. This is a video demonstrating the shoulder apprehension test, and it's going to test for glenohumeral joint instability. So I'm going to bring the patient's arm up like this, and I'm going to push anteriorly on the humeral joint, or on the head of the humerus. If she has some pain, that means that the joint is unstable. This is a video demonstrating the shoulder relocation test. So I'm going to place the patient's arm like this and push posteriorly on the joint. If she feels a relief of pain, then that means that it is more likely to be putting the joint back in place, and so there was some instability and I'm relieving that instability. This video is going to demonstrate the Sperling test, and what this test for is nerve root compression. So the position for this is extension of the head, side bending towards the side that you think is the nerve is going to be compressed, and then you're going to compress the head, so apply a pressure downward, but you don't need to apply too much of a pressure, and if it's positive, they will feel pain radiating down their arm. This video is going to demonstrate Phelan's and Tenderness sign, which both test for the median nerve. And so Phelan's is going to be, I'm going to have you put your hands like this, and so I'm going to have her hold that for 60 seconds or until she feels pain. If the pain is reproduced, then that is compression of the median nerve. And then Tenderness sign is going to be tapping right here, loud enough that you can hear it. And if she feels pain when I tap on her, that's going to be a positive, meaning that there is a problem with the median nerve. This is the standing flexion test. So for this test, your thumbs are going to be below the PSISs. So what you're going to do is you're going to find the iliac crest, and you're going to walk along the iliac crest until you find a bump. Once you find the bump, hook your thumbs just under it. Then you're going to tell the patient to go ahead and bend forward like you're touching your toes, and back up. And whatever side moves the most is going to be a positive side. And so if you have a positive result, that can mean that the innominate is stuck on the sacrum, but be careful because lower limb dysfunctions can also result in a positive standing flexion test. This video is going to demonstrate the seated flexion test. So to start, make sure that your patient's feet are flat on the floor and that they're sitting comfortably. Again, you're going to find the PSISs, so you're going to find the iliac crest. You're going to walk around until you feel the bump, and then you're going to hook under it. Then you're going to tell your patient to bend forward like you're touching your toes, and back up. And again, whatever side moves the most is going to be your positive side. And this could mean that the sacrum is stuck on the innominate. But with this one, any upper body dysfunction can also contribute to a positive test. This is going to demonstrate the spinal sweep and vertebral tenderness. So what you're going to do first is sweep down the spine. So you're going to find the midline, feeling for the spinous processes. And with one hand, just run your hand all the way down. And in easy terms, just look for mountains or valleys. So see if any of the spinous processes stick out at you, or if there's any dips in the spine. And if there is, that might clue you into the area of the dysfunction. Next thing you're going to do is run your hand down again, but this time ask your patient to tell you if there's any tenderness. So as I move my hand down your back, let me know if you feel any pain. Any pain? Okay.
Then that's that.
Then the next thing you can do is check for paravertebral tenderness. So those will be the muscles around the spine. So you can use both your hands and run your hands down to feel if there's any difference in the sides. And so up here, her right side seems like it's sticking out at me a little bit more. So I would describe that finding as right-sided paraspinal muscle hypertonicity.